So let's begin with eponymous fractures, means named fractures. First fracture will be atlas fracture. What is atlas fracture? It is a fracture of the first vertebra. What is the first vertebra? That is C1. That is atlas fracture. It is a fracture at the both anterior and posterior aspect. That is a burst fracture. Burst fracture means it is the fracture occurring at the due to axial loading that occurs due to axial loading. Okay. Next thing is second one, that is hangman fracture. What is hangman fracture? It is a C2 vertebral fracture at the dens, means odentire process, or dens is the process that occurs at the pars intercularis is the region where the fracture occurs. It depends on the where it has occurred. Third one is the clay showers fracture, that is lower vertebral spinous process fracture, that is C7 vertebral fracture. Next one is upper limb, that is Holston Lewis fracture, means fracture of the distal humerus, means fracture of the distal humerus with a radial nerve entrapment. Radial nerve entrapment means patient will be coming with the wrist drop. Wrist drop will be there for this patient, and the because it is a high radial nerve palsy. High radial nerve palsy. Okay. Next question. Next known fracture is the next one is the Monteggia fracture. Monteggia means, see, this is your ulna, this is your radius, this is your ulna. Actually, 1 minute. This is your ulna, and this is your radius. This is your radial head. The proximal ulna fracture with proximal radio-ulnar joint subluxation is the Monteggia fracture. Next one is the Galagi fracture. What is Galagi fracture? This is Galagi fracture. I mean, the name fracture where there is a distal radius fracture or distal one-third radius fracture with DRUJ disruption. Distal radio-ulnar disruption will be there. Distal DRUJ disruption, because these images are so much important that these will be given as an image also. They can be asked in a clinical scenario also. Here in both Monteggia and Galagi, supination, pronation movement will be lost. What are the movements will be lost? Supination and pronation will be lost. Okay. Next one is the nightstick fracture. What is nightstick fracture? This is a injury due to defensive mechanism. Defensive mechanism over the medial aspect of the forearm. Medial aspect of the forearm. When a person was attacked by with a hit or hit with a stick, what will happen? He will show the ulnar border. That the ulnar fracture will occur. That is nightstick fracture. Okay. Next thing is the named fractures will be the around the distal radius. What are the distal radius fracture? First one is the, see, this is the, I will show you one image that will give you a maximum idea. This is the radius. This is your radius. Okay. The radius is, this is the fracture, that is dorsal tilt. Dorsal fracture is the Colles fracture. Smith fracture is volar aspect, it is tilts. Volar aspect is tilted is Smith fracture. Barton fracture is a intra-articular fracture. Then it is a Barton fracture. It can be ventral or dorsal. Okay, depending on the displacement. So I will show you some clinical pictures or X-ray images. How does the distal radius fractures look? First one is the Colles fracture. This is your Colles fracture. How does it look? There is a dorsal tilt at the distal fragment. This is your distal fragment. Okay. There are 6 components in the Colles fracture. Okay. You should remember all those 6 components. Okay. Next one is the volar fracture. This is Smith fracture. This is Smith fracture. This is distal fragment is tilted ventrally. This is your thumb. This is anterior. So the distal proximal fragment is dorsally tilted. You should remember this one also. Okay. So there are, this is the classification is a Frickman classification. Frickman's classification is used for distal radius fracture also. Okay, next one is the next fracture is the supracondylar humerus fracture. What is supracondylar humerus fracture? Look, this is what supracondylar humerus fracture. This is supracondylar region most commonly occur at the male child 8 to 12 years. Approximate year will be maximum 10 year. If any question having the age like 10 years, and thus the classification is there, that is Gartland classification. That is Gartland classification. First one is undisplaced fracture. There is a sign that is called fat pad sign. Fat pad sign that it lucency in the x-ray. You can see in the x-ray, lucency in the x-ray. I will show you. This is the lucency in the x-ray. That is undisplaced fracture. The second one is the anterior cortex breach. There is a anterior cortex breach. Here the anteriorly it should be like this, but due to fracture it has got like this. This is anterior cortex breach. Type 3. Type 3 is that is completely free fragment. That is Gartland's type 3 fracture. Okay. Next eponymous fractures we'll discuss in the next video.